In one of my previous videos, I talked about primary headache in kids. So this is predominantly tension and migraine headaches. And in this video, I wanted to talk more about secondary headaches. And so secondary headaches are caused by something else. So it's headache plus the thing that caused the headache. So that could be trauma. That could be a vascular malformation. That could be a neoplasm. Trauma, we know, right? They hit their head, they fall off their bike, hit their head. In a car accident, hit their head. These kind of things, even colliding with another player playing sports. Vascular anomalies can cause severe headaches as well. So this may be a spontaneous head bleed or something called an arteriovenous malformation, where the arterioles and the venules don't match up exactly like they're supposed to. There's a malformation there, and so that you can have spontaneous bleeding. And then in some kids who are predisposed to stroke, like kids with sickle cell disease. And neoplasm is in general abnormal growth of tissue. So this can be a malignant type growth or a non-malignant or non-cancerous type growth. But trauma, vascular, and neoplasm, I lump together for this slide to kind of show like those would be the things that you could potentially need surgery for. And then under that, the next three would be infection, metabolic, and toxins. So infection, it can be something as simple as sinusitis. So sinus infection plus fever leads to headache. Now, many people think they hear the word sinusitis or sinus infection and think, oh, I need antibiotics. But the vast majority of sinus infections are, in fact, viral. Metabolic causes can be any derangement in the body's chemical processes to regulate or produce energy or perform any of our normal functions. So diabetes is one of these causes where patients who are having illnesses that are triggering their usual regimen to not work well, these patients can have headaches. And toxins, lead exposure, especially chronic lead exposure over time, and even carbon monoxide exposure. And so for prevention of secondary headache, I mean, there is a way to prevent some of these things. For trauma, we can make sure we're wearing helmets, car seat safety, appropriate restraints while in the car, these kind of things. For infections, making sure your kids have their usual childhood immunizations. I know they can be a hot topic, but things that cause significant headache and significant morbidity or illness, pneumococcus, meningococcemia, these kind of things that can lead to meningitis and some severe problems beyond that, we can prevent or mitigate our risk by having these vaccines. And as far as the toxins, having a carbon monoxide monitor in your house and getting lead screening at the appropriate times as recommended by the AAP, American Academy of Pediatrics. So again, making sure your child has their regular checks. This certainly doesn't cover all of the causes of secondary headache in pediatric patients, but it gives you a little bit of an idea. And so when your child says, I have a headache, hopefully you can use my first video on primary headache, use this video in secondary headache, and kind of go through what could be causing this headache.